Bismillahirrahmanirrahim. Good evening, everyone. My name is Dilshad Pirani, and I welcome you all to our Health Insight webinar titled COVID-19 Vaccines, Antibodies, and the Third Dose. Today's social media and all news channels are filled with the latest information and development on COVID-19 and its management, including antibodies and the third dose. With the deteriorating situation and recent lockdown in many countries, I am sure that all of us have many questions in this regard. We are honored to have with us Dr. Mahmood Warji, who will answer our questions. Dr. Warji is the Assistant Dean for Medical Student Affairs, the co-director of the Primary Care Clerkship, and an Associate Professor of Family Medicine in Clinical Medicine at Weill Cornell Medical College, Qatar. After years of experience in teaching and practicing family medicine in the United Kingdom, Dr. Warji moved to Canada in 1994. In 2003, he was appointed as a clerkship director at University of Calgary and has been in the Gulf region since 2007. A widely published researcher, educator, motivational speaker, and a practicing family physician, Dr. Warji has a long list of achievements to his name. As the point physician and consultant at his university on COVID-19, Dr. Warji has conducted various informative sessions since the outbreak and will today speak about the recent updates on COVID-19 vaccines, antibodies, and the third dose. As today's session is mainly question and answer session, I would encourage all of you to write your questions in our QA box. Without further ado, I would like to welcome Dr. Mahmood Warji to introduce the topic, and we will quickly start the question answer. Over to you, Dr. Warji.
Thank you, Dilshad. Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening to you all. It's my pleasure to join you once again and to help you with insights about COVID-19 in our current pandemic. Here we are 1 year later, over a year later now, into May, still going through the throes of the infection. And what's more alarming is seeing the infection spread throughout the world into developing countries and, of course, the biggest democracy, India, which is really having a very, very tough time right now. I think we've all had to learn to cope with the exigencies of the pandemic. There has been a tremendous advance. One of the best successes has been the production not only of a vaccine, but several vaccines, which are now in common use throughout the world. Our worry at this stage are few, but significant about the vaccines on 2 points. First of all, their efficacy, how well they work, and linked to that, will they protect us? And the second one is the inequality of distribution, so that 70% of the vaccines have been distributed to the Northern Hemisphere, while the southern regions, including places like Australia and most of Africa and South America, Colombia in particular right now, are short of vaccines. Now there is gradual penetration into Kenya and into Malawi, and South Africa already has it. So whatever you may read, there are daily updates. It's almost too hard to keep up with all the advances. But one of the problems is to decipher, especially on social media, what is true and what is not true, or simply malicious fake news. Today, I want to be able to be here for you to answer your questions and to give you some answers as you raise your own thoughts about what's going on with COVID and how it's progressing. Dilshad outlined right at the beginning the words a third dose and antibodies. I'm going to cover those very briefly now, and I'm happy to answer further questions on it. I'll do with the antibodies first. Let me say that if you have any brand of vaccine, wherever it is, whether it's one of the well-known ones like Pfizer or Moderna, or whether it's Sputnik V, whenever you have the full course, you will get antibodies without doubt, without a doubt. The first one will sensitize you to produce a response. The second one will boost that first response so that it moves it up to maximum immunity for that particular vaccine. Testing for antibodies used to be done routinely to make sure, as we were in unknown territory and we didn't know if in fact the vaccines were being fully effective. The answer is all of them are, in various percentages, but all of them are. Now, countries are beginning to drop the request for antibody tests because the simple question is, have you had your 2 shots? If the answer is yes, then the answer is you don't need to have antibody testing. In very special circumstances with people with certain illnesses, that may be necessary. But routine screening now is going to drop off. And I would say that you do not need to be anxious. When some of you have your tests and you get the results back, you say, the first reading was a bit higher, the second one was a bit lower. Am I losing my immunity? And get worried about it. There is no need to get worried. The mere presence of antibodies itself shows you have antibodies which are effective. I can go into that later if you have any questions. Second point is about this 3rd dose. I will tell you frankly, there are no plans for a 3rd dose at this time. The 3rd dose has been thought about as a theoretical advantage. One of the things we don't know is how long our current vaccination will last for. Estimates go to say that it could be something like 6 to 12 months. My professional feeling is more like 12 months, but probably not much longer than that. We haven't been through a year of COVID vaccinations yet, so we'll know more information later. But that does mean that after 12 months post-vaccination, we may need a 3rd dose, or shall I say, an annual dose. Not so much just a booster, but rather like the flu vaccination, we have to have one every year to protect ourselves. Now, the flu vaccine has been a bit hit or miss in that they produce a vaccine which they think will protect us by choosing certain strains. The WHO chooses certain strains in advance, anticipating which will be the virus of the time when the winter season comes. Today, we have a very great advantage because the COVID virus is known and we know the varieties and where they're from. Many of you have heard of the Brazil, the UK, and the South African mutants. And now we're getting a double mutant from India. So we are able probably to get a cocktail of those vaccines into one and hopefully use it as an annual boost, if you like, but an annual vaccination when the time comes. But I have stressed to you, no decision has been made about this yet. This is just going on past practices, learning about this protocol from the flu vaccine, which is a very similar virus, but of course not so dangerous as this one has been. So with that, I've covered that. And I think the best use of time is to simply open up the floor to your questions and hear what you have to ask me. So Dilshad?
Thank you very much, Dr. Raji. Yes, I have some questions. So there is a question where there is so much details about the test result. Can I request you, although you mentioned about that we may not need to go for antibodies tests unless we have a reason, but can you, it seems some people are going for antibodies test. Is there low antibodies or high antibodies in terms of result? If they need to respond to any, once they get the result, how do they need to respond to that? So we have one question where antibodies results shows SARS-CoV-2 IgG antibody 7.39 first on March 18th, and then second May 1st result shows SARS-CoV-2 IgG antibody 3.5. So they're asking, what does that mean?
Okay, so I anticipated this question and I've already partially covered it in my opening talk. So let me give you an example. If you have some food and you put some hot chili on your food, what is the first sensation in your mouth when you taste that food? You taste the chili. And it's nice, I hope, if you like it, but it's an impact. You definitely know you got chili on your food, right? But when you subsequently eat more mouthfuls, as you get further through the dish, you actually don't notice the chili quite so much. It's still hot, it's still there, but it's actually already made its impact. I use that analogy when you talk about antibodies. The first shot of COVID vaccine will have the greatest impact, and we expect the antibodies to be high. Thereafter, your body actually gets used to the antibody production and it calms down, if you like. The system in the body is not so angry because it's got used to this foreign stuff being in your body. Therefore, if you have a second antibody test, you may all find it drifts a little bit low. When you have the second shot, there may be a transient rise and then a slight drop off. So you're not to worry about those results. And this is where, in fact, the authorities feel there's a cause of potential worry, anxiety, and confusion. What do these results mean? Am I okay or not? Should I have another shot or whatever? I can assure you, once again, once you have your full course of 2 shots or the 1-shot vaccine, or in Qatar, there's just 2 vaccines which are used, which are both double shots, you do not need to have an antibody test anymore to prove you have antibodies. You will know, many of you will know that you had an effective vaccination by simply having a sore arm. Many of you have had a sore arm with the first shot, and some of you may sustain more side effects with the second shot. That is all living proof that the vaccine is working for you. I hope that answers your question.
Our next question is safety of COVID vaccine Sinopharm during pregnancy, as so far Pfizer and AstraZeneca vaccine results are available and both are mRNA, but Sinopharm is dead virus. Can you explain this?
The evidence goes to show that women are more at risk, pregnant women are more at risk of getting virus infection than ordinary people. I want to include here breastfeeding mums as well. Certainly, there was some hesitancy at the beginning because there were no clinical trials on pregnant women during the early stages of the development of the vaccine. In the UK, they felt they had sufficient evidence to support vaccinating pregnant mothers and also allowing breastfeeding mothers to have the vaccine. That has been a calculated risk without a trial, but it has worked. And there have not been any significant side effects or effects on the baby in those people in the UK. In the US, they said, no, we haven't proven it. They're a little bit more fussy. But then they came around and they said, actually, we've reviewed everything and we agree that those who request it can have it. and they have had no problems either. You mentioned mRNA, but the principle is the same. The fact that the virus in Sinovac is dead is immaterial to the immune response. And it's not as if Sinovac is inferior. So there seems to be no reason to forego a vaccination of a pregnant mother with whatever vaccine is available in whichever country. The one contentious one right now is AstraZeneca, and that has a mixed reception. And there's been some hot and cold and stop and start with that. We don't have to deal with that in the Gulf region at this time. So my answer is, if you feel that you are in possible danger and something might happen to you if you're a pregnant mother or a breastfeeding mother, don't be feared. It is, so far, absolutely safe. What is important is, if you are not vaccinated, the chances of catching COVID and having some serious problems or even death are far, far higher and far more riskier than any kind of side effects which you may have heard about. These, of course, are always reported when there's something newsworthy, if you like, something bad, something's gone wrong, something happened which wasn't expected. But it's rather like hearing about a plane crash. When you hear about a plane crash, all attention is on that. What happened and what the whole event and videos, but you don't hear about the other 99,099 planes which have taken off and have landed perfectly safely without any incident at all. So this must be a measured response. It's really a question of looking at the advice that is available, and there's nothing mandatory about this. You're perfectly free. But I would say, if I had a relative in my family who was pregnant and asked if they could actually have the vaccine safely, I would say absolutely, absolutely, because the chances of getting COVID and having a serious problem, ending up in ICU, are much, much higher. And ultimately, of course, you don't want anyone to die. So that is the thing you must decide. It's not by force, but if you do request that vaccine, then I can at this time say we have a pretty good record that nothing is going to happen to you.
Okay. Our next question is, we are unable to get second dose of vaccine. So far, we know that if someone receives one dose, risk of infection is 1 in 5,000. After second dose, 1 in 13,000. Without vaccine, 1 in 1,100. How long the efficacy of one dose sustained if second dose is delayed? Can you please reply on that one?
Well, I'm not sure where these figures originate from. It's the first time I've heard them. And there are all sorts of figures and estimates that are being bandied about. I would rather put it another way. After the first dose of, say, a Pfizer or Moderna, you have up to 70% protection from 0 to 70%. I think that's a much more positive way of looking at it, rather than say, I'm 1 in 13,000 or whatever. It actually doesn't matter, and it's meaningless to actually say there's a 1 in 13,000, because if you're in a group and you, for instance, are exposed to the South African virus, which is the one which is sweeping the Gulf region, if you're in a group of people and someone has it and you're in a room together and you don't take sufficient precaution, or there is close proximity for about 15 minutes or more, the chances are all of you in that room will get it. Now, that's not 13,000 people. That's all of you. So you need to practice precautions and protective measures at all times. The chances of getting COVID with the South African variant there are probably 3 or 4 times, it's 3 or 4 times more transmissible. So one person can give it to 4 people, up to 4 people, or more, depending on their proximity and how they move around. Now that is, pretty well 100% chance of catching it. So in that particular circumstance. So I would like to say that about the vaccines do vary. And by the way, I take the opportunity to say that Sinopharm has had a little bit of a bad reputation from the point of view is that it's regarded as not having sufficient efficacy or the same efficacy as the other big two. Well, that actually has been revised, and Sinopharm has an efficacy of above 70 to 75%, not the 51% that was earlier thought. Sputnik V, the Russian one, has an efficacy of 97%, which is better than any vaccine that's been produced. The problem is that Sputnik V, although very successful, is not fully approved. And although some developing nations have been given it and are purchasing it, and it will be very effective, some of the more traditional Western countries have stuck to the protocols that they have in place for their regulations to approve it. And that one hasn't been approved. So to date, all the vaccinations that are around have been effective. All the ones that you can mention: AstraZeneca, Johnson & Johnson, Pfizer, Moderna, Sinopharm, Sinovac, Sputnik V, and there are others coming on as well. If you have any of those vaccines, you from zero, you'll go to 70%. And I think that's a very reasonable figure to have protection. Having your second dose, you will probably go to between 85 and 95% protection. So you can see the massive response from the first jab, and that would probably account for the higher antibody count. And then the smaller increase for the second, which gets you up to the maximum. Then your body recognizes the vaccine when it hits you.
Thank you. Next question is, what will be the timing of vaccine during pregnancy? As soon as possible or during third trimester?
My guidance is to probably wait for the first 3 months to pass, but there is no reason why it cannot be given in the second trimester, as soon as that.
Okay. Okay, my next question is, I have anti-SARS-CoV-2 spike protein quantitative antibodies of 3.1. I had taken both of the doses of Sinopharm in February 2021. What does it mean? Do I have to take any other shot or booster shot? How long is the effect of this? I think you have answered this question.
No, I want to reiterate that because this is we're not all doctors. We don't always have the explanation, and it's fair to understand if anyone pokes a needle into you and takes a sample, you want to know what the test result means. The answer to that is simple. If you have any antibodies at all, and people will vary in their response, some respond modestly and have no symptoms at all after the vaccination is done, and some respond quite strongly and they do have some symptoms. Both are protected. Both are efficient. And the actual quantity, whether it's 3 or 4 or 5, does not matter. It means you have got the spike protein, the spike antibody to the vaccine, and that is the one we're all trying to give stimulation to everyone with the vaccine. If you have both antibodies and they test for 2, the second antibody, the N antibody, means that you have had or been exposed to COVID infection itself. Now, there's an argument. If I catch COVID, do I need to have a vaccine? Do I need to have that vaccine to protect me? Because I've already had the infection, so surely I've got antibodies naturally. Well, the answer to that is you may not have antibodies to the spike, which means if you have COVID and you've recovered and you only have N antibodies, then you are more likely to catch COVID again, probably within anything like 4 to 6 months. But if you have the spike protein through the vaccine, once you have the vaccine, both doses, you're guaranteed to have the S antibody, and that will fight your defense on another direction so that you don't even get infected and have such serious side effects. If by chance you happen to get the infection, it will be very mild, and you will certainly not end up in hospital or in ICU.
Thank you. My next question, if you have taken Sinopharm and show low antibodies, is it okay to take Pfizer after?
No, you must wait, have your vaccine, and let it do its thing. As I've mentioned, Sinopharm has been underrated, and it gives you a very good rate of protection. The problem here is that once you start mixing vaccines, there are two problems, actually. First of all, we don't know whether that'll impact or protect you any more than the original vaccine that you've had, provided you had the full doses. The third thing is a moral issue. The second thing, rather, is a moral issue. There are people in the world, and especially in places like Pakistan and India, where the vaccine's in very short supply. I think it would be wrong to deprive somebody of a vaccine just to make sure that you think it's a good idea to have a third shot. When we actually are in a position to give third shots, we will know. But at this stage, for instance, Pakistan's vaccination rate is 2%. In Dubai, it's over 90%. In Qatar, it's 60%. So I think that you shouldn't be thinking in terms of, I need to keep jabbing myself until I actually have something which pushes my level or whatever up to a certain level, and that makes me happy. Be happy with the vaccination that you've got. And Sinopharm is a good vaccine and is effective and gives you sufficient protection for you not to worry about having a third shot. The question really is, when would you give that shot? And supposing people started having a third shot, say a month later, and then had serious side effects or serious reactions, what would you say to that? There is no evidence to show at this time that a third shot within 3 or 4 weeks after the last two is going to be any more effective, because your immunity is boosted to the maximum ability of your body at that time. So I would say at this stage, do not think that you're being forgotten or missed out, or that it's an oversight. If you happen to get a Pfizer vaccine, then you're probably going to be fine. If you're in a country which offers only Sinopharm or Sinovac, I know if I lived in one of those countries and there was no Pfizer, I would absolutely have the vaccine that was available and get some protection, if not significant protection, from that vaccine alone. So I would caution you about trying to get a third shot when it's not recommended and not authorized. And there should be complete transparency. If you actually do have your 2 shots, they should be recorded. They're usually on an app. And I want to reassure you that there is no indication for another quick shot to try and do anything better to yourself. You might end up harming yourself rather than protecting yourself more.
Our next question is, what vaccine can people with epilepsy take?
People with epilepsy can take any vaccine that's available. There is no contraindication to any of them.
Is the Indian variant different? What is the reason for such bust?
The Indian variant is different, and it's come late. It's come late after the UK variant, the South African variant, and the Brazil variant. The main problem at the moment in the Gulf region is the South African variant, which is making the people who are in hospital as ill as they are. But all the vaccines being used in the Gulf are effective against the UK variant, and the Brazil mutant hasn't really got a foothold in the Gulf. The Indian mutant, if it arrives in the Gulf, will not stand a chance, because the space is all taken. If you like, in Dubai, there's not many people left to infect. They have effectively reached herd immunity. Herd immunity meaning the majority of the population has been vaccinated or has had the infection and cannot get the disease seriously again. The vaccines cover all of these vaccines, all of the mutants rather, with the exception of the South African variant, where Pfizer covers the UK variant 95%, it only covers the South African 75%. So having used figures during my talk of 70+%, that's still very good. So the Indian mutant hopefully will not be able to get a foothold in the Gulf because the Gulf region has done such a good job. Bahrain is another country which is doing excellently in vaccinating its population.
Thank you. Some GCC countries are planning to give 1 dose of Pfizer and the 2nd dose of AstraZeneca. How safe is that trial?
That is actually up to the government policy. I cannot comment on that. Myself, the protocol really is you have 1 dose of one type of vaccine, and as a 2nd dose required, it should be the same type. I am not sure where this question came from or which country it is referring to. I certainly have not heard of it, and neither is it recommended.
Thank you. I have heard that Europe is not going to consider Sinopharm vaccines, so traveling is going to be difficult. Is that true?
That is a difficult one because Sinopharm vaccine is valid in the Gulf, but the Europe may not accept it for immediate entry into a European country. In other words, they may certainly will require a pre-test, a PCR test, not more than 72 hours before arrival in Europe. So you basically have to have a COVID negative test before you fly. And then when you arrive in those countries, you may have to go into quarantine. Now, Europe is opening up and they're allowing European countries to travel more freely now. And it really is a question of the policy at the time. I cannot comment on that at all, but it's not as if you haven't got protection. So simply saying, if you have Sinopharm vaccination, and then you have a negative COVID test prior to flying, and then you arrive in a European country, you may have to go into quarantine, do your quarantine period, and then you can travel freely. So other countries may actually be recognized as having had a vaccine which protects you, and when you arrive in Europe, you are free to move without quarantine. I hope that makes sense. I want to make one comment here, and that is a lot of people are trying to travel from Pakistan and India to the States, either to go back to join their families or go back to work. The US regulations state very clearly, and this has been in place now for a while, that they are not accepting travelers from 6 countries, which includes Bangladesh and Nepal, China, and Iran, to go to the States if they actually go via Europe. If you go to Europe from those countries and then attempt to go to the US, you will be refused entry and sent back. If you go directly from Doha or from Dubai to Europe and then try to go to America, you will be refused entry. You will be sent back. If you fly directly from Doha or Dubai or Abu Dhabi straight to North America and everything is in order, that is when you'll be able to get entry. So there are lots of regulations, and the best thing is to read the airlines regulations and the government lines, and to check with the various countries' governmental sites, like the US government site, for instance, to see what actually is on their protocol for allowing entry. As you probably know, that the US no longer requires people to quarantine on arriving, which is a really good thing. They've removed that restriction. But depending on which country you're coming from.
Thank you. Next question is, the explanation provided on the assessment of the antibody results are new to many of us, as everyone now is rushing to get the antibodies test done to see their levels of immunity build up. Can you share a reliable source that we can read more on this subject of antibodies?
I want to say again that this rush to get antibodies done is really, shall I say, using up valuable time, valuable resources, and is a waste of money, frankly. Qatar has discontinued it completely because they have done so many tests and they no longer feel it necessary. I would imagine that Dubai will actually bring that in very soon. If you go to a private clinic, it's expensive, and it really doesn't show anything apart from the fact it proves you've had the vaccine. That's it. It's not a question of levels. It's not a question of not having a level. It's not a question of being protected. How can I liken it to another example? You have a car, you have a tire, and you've actually bought it a month ago, and you say, that isn't quite the same color, and it looks a little bit flatter than it should be, and I'll check the pressure, and it's not the same as the other tires. Therefore, I'm going to go down to the shop today and have it checked and make sure there's nothing wrong with it. So you take it down, they get it checked, they take it off, they pump it up, fill it up, check it, and they say, there's nothing wrong with it, sir, madam, and put it back in your car. How many times are you going to do that? How many times must you be reassured that the vaccine works? So, as a professional, I would say, don't get anxious and don't feel that the antibody test, which is going to go out very soon, is essential, necessary, or helps you in any way at all.
Thank you. If blood pressure is high after medications, as well as sugar is also high, then would taking the vaccine do harm or be fatal? This question comes as COVID is dangerous on comorbid person.
The comorbidity stands for a warning that people are more vulnerable to catching COVID. It has nothing to do with the vaccination itself. When anyone goes for a vaccination, they have their blood pressure checked on arrival. If it's normal, they go ahead, even if they have diabetes or have a history of hypertension and are taking medications. If it's normal, there is no contraindication to vaccination. If they are taking medication for diabetes or hypertension, they arrive at the clinic and their blood pressure is slightly up. They're asked to wait. And within about 20 minutes, you should know whether the blood pressure has gone back to normal or not. In other words, within a normal acceptable limit. Then you can have the vaccination. COVID vaccination does not raise your blood pressure. The thing that raises your blood pressure is the anxiety. Will I be okay? Will it hurt? Will I have a side effect? Is there anybody in the room who's not wearing their mask properly? That raises blood pressure. So a little bit of rest, a little bit of reassurance. And my advice is, if you have an appointment to go for a vaccination, go a little earlier. Find a place where you can sit, and all the places are separated very clearly so you have sufficient social distancing. Sit there, just read a paper, or chat quietly to any family members, or simply just relax. And when you're called and you get going through for your vaccination, you should be fine. So providing your blood pressure is okay at home before you go, and usually it is, then there's no reason not to go. If it goes up a little bit when you're at their clinic, that's understandable. But they'll wait, they'll see if it settles, And once that happens, you can have your vaccination, no problem. Comorbidity itself, simply, I reiterate that, comorbidity means you're more susceptible to catching COVID infection because your immune response is already weakened. That's why it's easier for you to catch. That's why people who are older, 60 and 70, who have diabetes, hypertension, suffer more. However, the trend is changing. And now we actually see something like 30% of infected people are in adolescence. That's been quite a change from last year when there were very, very few children getting infected. Now that is not the case. And they don't have comorbid conditions. Not many anyway.
Thank you. There's one request, Dr. Varji. Can you please repeat which countries are barred from entering USA? Does this apply to American citizens as well?
No, American citizens are allowed to return to their country of nationality. Non-citizens, people who are green card holders too, I think, can go back. But non-US citizens from India, Pakistan, Nepal, Bangladesh, China, and Iran. South Africa. I beg you, not Iran. South Africa are not permitted to go to the US at this time from their own countries.
Thank you. Can you brief us about Covaxin and COVID Shield, which are being manufactured and inoculated in India? What are the efficacy rates of these vaccines?
COVAX vaccines were bought by wealthier nations to distribute to poorer countries or those countries more in need of vaccinations. They are basically the same brand, only under the name of COVAX. They're just as effective, and really they've been subsidized and given to the countries for free, particularly in Africa and Asia and in South America. There's not an inferior vaccine. It's really under a scheme to vaccinate people in countries which essentially cannot afford the massive cost that the more wealthy countries have been able to afford.
Thank you. If someone undergoes surgery, when it will be best for that person to take vaccine?
Well, providing they're well and they recover from the surgery, within a couple of weeks should be no problem. I think it would be best to recover from their surgery first. After surgery, you're not allowed to, certain surgeries, you're not allowed to fly, for instance. After a heart attack, you're not allowed to fly for a month. So after a surgical procedure, which is not a major issue, after a bad car crash or whatever, something like that, obviously you're going to wait until you're fit enough to travel. But if it's a simple procedure, say like a hernia or an appendix, within 2 weeks you should be fine. It doesn't affect your immunity.
If my blood pressure is 150/85, can we take vaccine?
150/85 is on the borderline. If that's your regular blood pressure, you need to have that looked at by your own physician of care, because the 150 is beyond the maximum of 140. 85 is okay. So the limit that we have is 140/90. What will happen is you won't be rejected. You'll be asked to go home, rest, and come back, and hopefully it will settle. As I said before, part of the anxiety is just simply being at the clinic. If you actually wait and have it retaken, you might well find it drops down, in which case you're fine.
If my fasting blood sugar is 170, can we take vaccine?
The answer really is, if your fasting blood sugar is 170, that obviously shows you have diabetes. But as long as you're stable, you have no infection, have no chest problems, have no other illnesses or skin rashes or skin problems, you actually would benefit by having that vaccine as soon as you can, because you are comorbid, you have a comorbid condition, and you are certainly a high priority for vaccination. So diabetes does not stop you from having the vaccination. In fact, all diabetics should certainly make it a priority to get vaccinated. Of
Can
course,
people,
we
sorry,
need to pay attention to the sugar because it really shouldn't be running quite that high.
can people be allergic with Pfizer vaccine?
There have been some allergic responses, very few, non-fatal. And one of the more common side effects emerging right now is a skin rash from the site of the injection. So you have the injection, and then within a short space, a couple of days, you may feel some redness, and it spreads. It's like a little growing red patch, and it can involve, quite a bit of your arm. But it's harmless. It's self-resolving. There's no treatment necessary, and you need not worry about it. It's a little bit alarming, but it's not fatal. And I think you mentioned fatal earlier on. I didn't really answer that part there. I can address that later again if you want. But certainly some of these side effects are a little bit annoying, and they do happen. Most of them are written up in the guidelines, things like chills, fever, muscle ache, headache, etc. They are all well known and part of the trial information that we have at our hands.
Thank you. If I have food allergies, can I take Pfizer vaccine?
Answer is yes. There is nothing in the vaccine that would give you a food hypersensitivity that would make you react as a food might do, like peanut butter. If you have an allergy to that, the injection is not going to cause any problems.
Thank you. Should we be worried about blood clots after vaccination?
Well, there is a big contentious issue right now with AstraZeneca. I can tell you this, that everybody is prone to blood clots at any time, even if they're healthy. What is probably not really known is that every single one of us alive has a very small blood clot in our bodies someplace during any part of the day. But they never actually get anywhere or do any harm because our body recognizes that and solves it. Where it becomes a problem is when someone, say, has a heart attack and there's a clot which blocks an artery, which obviously causes chest pain and problems. That's a different matter. The vaccine-associated clot that I think you're referring to is more of a worry. However, the incidences of blood clots forming, while quite widely reported, have very rarely ended in death. I know that at least of 5 people worldwide who have actually had a vaccine and have subsequently had a clot and died from it. That is unpredictable. It may be they had a condition before the vaccination which simply didn't go well. And I can understand people saying, I don't want that brand of vaccine because I don't want to get a clot. But the long and the short of it is that the chances of getting COVID and dying from COVID are far, far higher than actually getting a clot which could kill you. Most of the clots that have happened have ended and resolved satisfactorily with healthy regaining of health. It's only in those tragic cases where some people have had that body condition where they haven't been able to process the vaccination properly and have suffered a severe side effect. Now, the chances of, let me take another analogy. The chances of having a car crash, a car accident, on any journey that one takes is far, far, far higher than actually having a blood clot. And I put that in perspective because if you're worried about something happening, in the remote chance that it might happen to you, and it's so small, the odds are so small, and you actually are prepared to risk getting COVID and possibly dying of it, then that is a personal choice. You don't have to have that vaccine. If I knew there was a vaccine that was the only vaccine available, and the one at the moment is AstraZeneca, and it's been restricted to certain age groups, I would take it because I want to be protected, and I would take my chances. So I don't think a vaccine should be rejected, or maybe you fancy another vaccine which hasn't yet come into the country, and you'll say, I'll wait for it, and risk the chance of getting COVID and then having a serious problem. We know that 80% of people who catch COVID never develop anything serious. 20% do. We can't predict who that 80% is, and those 20% are. So, it's a question of you have to decide. But I would not simply reject a vaccine because I had heard or I was aware that there was a very small chance. And when I mean small chance, I mean, if you're talking about one in 250,000, you know how small that chance is. Okay? So protect yourself. Nothing's mandatory. You have to decide for yourself whether you want to take that chance or not. And I would say that most people who are offered the AstraZeneca vaccine, a vast majority are accepting it, knowing that there is a remote chance there may be a problem. There are problems with every vaccine. There's problems with everything that we do. There's problems with things that we buy. There's problems with TV sets that we buy. There's problems with cars that we buy. There's always going to be a problem somehow. The emotive thing here is we're dealing with health. Cars can be replaced, TVs can be replaced, but bodies can't. But to be absolutely upfront with you, I would say you have to measure what you want to do. Do you want to protect yourself and take a tiny risk, or do you want to take a huge risk and be in a third wave, a second wave, third wave, and really, end up perhaps not making it at all? If you look at India right now, this is the first day they have had over 400,000 new people catch COVID in just one day. Almost none of them have been vaccinated, if any.
Thank you. Can you explain why a mutating virus is more dangerous?
All viruses mutate. The flu virus that we used to know mutates. And when it mutates, it changes in order to survive. If it didn't mutate and we had an answer to beat it, then it would die. And that's not in the virus's interest. So it mutates to keep alive. But the human mind and the technology that we have at our disposal keeps us running ahead. I think it's a magnificent effort that we've managed to get so many vaccines so quickly. I said last year when I talked, the vaccines would not be here before the end of the year. That was the estimate, and that was very close. Some vaccines were actually produced and validated and started to be used in December and January. So it really is a question really of looking at the odds, where you are, what you're having, what you're doing, how you protect yourself, as to where we're going to go. We cannot predict what's going to happen. all we can do is take the maximum advice to protect ourselves, to make sure we actually eliminate any chance of exposure or unnecessary exposure. Does that answer your question?
Yes, thank you very much. Um, Once fully vaccinated, can we discard our masks safely at home with our family?
If you are all one family, and even if there are children at home and there's no other visitors, so you may have relatives, but they have never come to your home and don't have shared meals at home. If the children are okay and healthy and well, and all the parents and the adults over 16 have had their vaccinations, yes, you can remove your mask in the home. As soon as someone comes to the door, a delivery man or something like that, or if you have perhaps a domestic worker who lives outside the house, then you must wear masks. You cannot expose yourself to somebody who lives outside and comes into your home daily. But if it's just the people, say the domestic workers have gone home, they're out of the house, and you are all just the family, 4, 5, 6 of you, you can take your mask off, not a problem at all.
Thank you. How long do you think the pandemic will last?
How long is a piece of string? How many raindrops fall from the sky? Can you count the snowflakes as they fall on the ground? Does the geometrical, the arithmetical denomination pi have an end? It's infinite. So I would be a clairvoyant if I could tell you. My best guess is that things will begin to settle down. However, I do think a third wave, less of a problem than the second wave, a third wave could happen. But I think that we should see some light at the end of the tunnel by the end of this year. That is in countries which are being effectively vaccinated. The problem about travel and mobility remains to be seen. The Seychelles, for instance, was in a bubble and had a very, very low incidence of infected people and was doing very well and was touted as a holiday place to go. Just last week, they've had a substantial increase in their population's infection. Somehow, COVID has got hold of them. Nowhere is safe. So you just have to protect yourself. But if you gave me the freedom to say, how long is it going to last? I would say things should be better by next year, this time next year. They should begin to improve by the end of the year. But in reality, for the global world, I anticipate it's going to take much longer. I don't know how long. We're already seeing the UK opening up. We're seeing the US open up. And there are some places who haven't bothered to do anything at all to protect themselves. And they have been hit very badly, even though they were fine before. So just have to keep your eye on the paper and the news, listen carefully. And at this stage, I think travel is only if you have to travel rather than a holiday. Although Europe is also opening up and they're now starting cruise ships. But you know what happened with the cruise ship right at the beginning? And that's when it all started, when everyone on a cruise ship suddenly caught COVID and they offloaded in Australia and they had a massive problem there. You probably recognize that story. I cannot tell you how long it's going to last or when it's going to end. What I do feel is that this is actually something, and COVID is something we're going to have to deal with for the rest of our lives. But it will be under control. So it will never completely disappear. But it won't be the killer that it is or has been. Don't forget that there are about 60 to 100,000 people who have died for years with just the ordinary, so-called ordinary flu virus. That hardly gets a line in the news, but that is a fantastic number of people to lose their lives.
Dr. Virji, can you share the current status of herd immunity?
Herd immunity basically is where a population has been either vaccinated or has got immunity from infection and can't be reinfected again. If you take things like measles or chickenpox or meningitis, these are all vaccines which are used for certain types of viruses there. And once you get to a level of around about 70%, it's probably between 70 and 80%, you can then be regarded as having herd immunity. I think that with the UAE having got to 90%, they're pretty well there. Qatar's heading for it, and so is Bahrain. The UK has only got to, I think, about 50, 55%, not quite there yet. And the US has a massive population and is not there yet. So once the majority of the population in the country live have protection, there is nobody more to infect. There are very few people left to infect. And that is the concept of herd immunity. You're not going to catch it by going out shopping because somebody is there waiting to pass it on to you. They're already protected and they won't pass it on to you. Is that clear?
Yes, thank you. My last question is, if somebody misses their second dose of vaccine, is there any timeline which they need to be worried about now because they missed their second dose?
Well, the recommended guideline for Pfizer is 3 weeks, and for Moderna is 4 weeks. Pfizer can be given to people 16 and above, and Moderna can be given to people 18 and above. So missing that is not so serious. To get the full immunity, you do need a second dose. And we now have evidence to show that a 3 to 4 month delay will not significantly harm you. In other words, you can have a dose, the second dose, as late as that. And the reason for that is availability of vaccines, and still get to the level of immunity that we have seen in just the regular doses. No one wants to wait 3 or 4 months, but it's best to get one shot on board, and then hopefully the second shot will come as soon as it's available. That was the premise. In the UK, they started doing that. Rather than have one person have 2 shots and be given in time, they decided to delay the second shot and give another person a single shot. And that's how they succeeded, and it's worked. So don't be worried if you're a little bit late, but certainly try your best to get it done when you have your appointment. Unless, of course, you're told there is no vaccine, you'll have to wait. It won't harm you. You just have to be careful, again, about protecting yourself.
Thank you.
Although you still have something like 70% immunity.
Our time is done, but I have one related question.
Yes.
If we have herd immunity, then why our numbers are so high?
That is a bit of a tautology question, because you have to have, if you like, a large number of people infected to get either the natural disease while you're vaccinating the rest of the population. Don't forget, the effect of the vaccine is not immediate. It takes 14 days for that vaccine to take full effect. And there are a large number of people who've been infected just prior to getting vaccinated. They didn't know they were infected, but they have been. So they have double blow. They have the vaccine, and they have to build immunity, and they've also got the infection, which they have to fight. So the biggest reason for the large number rising is because of failure to adhere to wearing a mask, washing hands, or social distancing, and infecting people, passing it on to others while they're waiting for their vaccines. That is not the case in the Emirates, in Qatar, or Bahrain. and because they are all approaching herd immunity. So if you like, it's an oxymoron to say there is herd immunity and there are lots of people getting the infection. It doesn't work. You can't have both ways. In India, there is no herd immunity, as we know. Everybody is getting it. I just quoted the figures of over 400,000 because they're not vaccinated. They're nowhere near herd immunity. Whereas the Gulf region has got some countries which are very fortunate in having basically achieved that already. The numbers in both the Emirates and Bahrain and Saudi and Qatar and Kuwait are falling. Every country is falling as they increase their vaccination rate. So I hope
Thank
that.
you. Thank you. Last question. We are running short on, we have quite a few questions, but there is one question that, can you talk impact on children in this pandemic? Like now we are learning that age is changing, like now children may be getting vaccinated. So can you just share some of your expertise around vaccinations and children?
Well, they've done trials on children from 12 to 15, and they show it works. So there will be a whole load of changes while children between those ages get vaccinated. Because last year, as I said, they didn't seem to be affected, but this year they are being affected. And that'll impact schools and various educational places. The younger age group, they're doing trials right now from the age of 6 months to 12 years. Those trials have yet to be completed, but the results to date look very good. So once they have proof that they're not going to be harmful in any way, I think and confidently predict that there will be vaccinations from the age of 6 months upwards. The only reason why they're not going to be under 6 months is because they don't have the sufficient ability to mount an antibody response. In that respect, I would certainly promote any new mother to breastfeed and to think very hard about breastfeeding, because that will give the baby, her baby, the antibodies that she has and protect the baby up to 6 months and maybe up to a year before they actually can vaccinate. So yes, the pattern has changed, but I am very, very confident that that problem will be addressed very shortly, within the year, no doubt.
Thank you. One question which is applicable to all of us, I feel, can family members who have received both shots meet for meals?
The answer is no, not yet. So if you have two families living in two different households with different people visiting different places, they should still not mix. We are currently in Qatar under a level 4 lockdown. When the government lifts that to 3 and then 2, we'll know, and we should listen to our respective governments. It is not wise nor appropriate, and in some cases illegal, to have more than a certain number of people in a household or a gathering, shall we say. So do not mix families at this time. If you are in open air spaces, there is probably some justification for meeting while masked in open spaces, but you're not going to have a party. It's just a question of being in a vicinity. When you go to the shops to buy food, you're in the vicinity of other people. And, it's not a question of you can only have 5 people in the shop. But no, I strongly recommend, and I'll tell you why. Because I had just exactly that incident happen, where two families, related, large families, who happened, one of them from the other family just dropped in for a day to the other family, who were fine and healthy, and then left, and then fell ill and told the family that was just visited, I've got COVID. And guess what? None of them had any masks. Everyone was trusting, and the whole household was quarantined because they all caught COVID. That is the danger. Now, if they're vaccinated, it's still not recommended that anybody from outside comes into the house. You want to stay infection-free, and people coming into the house may be asymptomatic and still pass it on. And you can still technically get COVID after you're vaccinated, although it won't be so serious. But then, of course, you can't go to work, you can't mix, you can't go out, you can't go shopping. You have to stay inside, and that's very inconvenient.
So thank you very much, Dr. Verji. Once again, we like to thank you. It was a pleasure to have you with us today.